the only video you'll ever need to watch on premature ejaculation. I'll tell you everything you need to know: how we define premature ejaculation, what are the causes of premature ejaculation, and what are the treatments. So watch this video till the end because it's jam-packed with info. Hello everyone, I'm Dr. Anoneet Sabharwal. I'm a Delhi-based psychiatrist with a decade-long experience in sexual health, addiction, and mental health. Let's begin. Now before we start, remember that I do a cycle of one video on mental health, then one video on sexual health, and then one video on addiction. If you're looking to watch a set of videos on one particular theme, just click on the playlist from the links in the description box below. Alright, let's go. This video is a two-part series. In part 1, which is this video, I'll be talking about the mechanism of ejaculation, the definition of premature ejaculation, the causes of premature ejaculation, and the medical and surgical treatments available for premature ejaculation. In part 2, which is going to be the next video I upload, I'll be talking exclusively about home remedies or what you can do at home to last longer in bed. So sit back and take as much knowledge as you can from both parts. A lot of men worry about having developed premature ejaculation, and many of them don't really have it. So let me clear this misconception once and for all. Porn isn't bad at all, except when you start using it as a sex education class. Porn is a source of entertainment, and just like any film, it is a work of fiction. No normal healthy male can last the 30 to 40 minutes you see in porn without ejaculating at least once. In fact, the average sex act, including foreplay and penetration, lasts anywhere between 5 to 7.5 minutes. And you'd be surprised to know that more than 40% of males ejaculate within 2 minutes of penetration. So let's just go behind the scenes of the male climax. Ejaculation is controlled by the central nervous system. When men are sexually stimulated, all of our sense organs have nerve endings which transmit information through the spinal cord and then to the brain for processing. When men reach a certain level of sexual excitement, the brain decides to relay information through the spinal cord to the penis. This transfer of information is referred to as the reflex arc. The reflex arc causes the semen to be released, which is called ejaculation. Ejaculation has two phases: emission and expulsion. Emission is when sperm moves from the testicles to the prostate, and this is really the semen factory where sperm is mixed with a bunch of other stuff to make semen. The semen then moves from the prostate to the base of the penis, and this is through tubes called vas deferentia. The next phase is called expulsion or discharge. In this phase, the pelvic floor muscles or muscles at the base of the penis contract, and this forces the semen out of the penis. Here, ejaculation is complete. Usually, ejaculation and orgasm occur simultaneously. In almost all cases, erections go after you reach an orgasm. So remember this point: if someone's telling you that they can go on after orgasming, they're probably lying. It's biologically impossible. Let's now define premature ejaculation and see what the medical books say. Premature ejaculation affects up to 30% of all men, and it is the most common sexual disorder found in males. Now, the International Society of Sexual Medicine defines premature ejaculation under 3 main headings. The first heading is time to ejaculation. In cases of lifelong premature ejaculation, where early ejaculation has happened since the person's first sexual experience, the time to ejaculation must be 1 minute or less. In cases of acquired premature ejaculation, where the person earlier had sexual functioning which was normal but now has early ejaculation, the time to ejaculation must be 3 minutes or less than 3 minutes. The second heading is the frequency of early ejaculation. Early ejaculation must happen in all or nearly all vaginal penetrations. And the third one is the personal consequences, which include frustration, angst, and also avoidance of sexual intimacy. I'm sure you've been told different versions of what premature ejaculation is, and I'd love to know what your earlier perception of premature ejaculation was. So write to me in the comment section below and let's call out half-truths. Also, if you're enjoying this video, don't forget to smash the like button and subscribe right now. Done? Let's move on. Let's discuss the causes of premature ejaculation. The causes can be psychological, biological, or both. Psychological factors play a massive role in causing premature ejaculation. The reflex arc of ejaculation is essentially a learned reflex, and therefore faulty learning will cause faulty ejaculation. Let me give you some examples. Most commonly, in cases of sexual repression, where there is strict sexual teaching and upbringing, the person trains himself to ejaculate earlier to avoid being discovered masturbating. In other cases, where there are negative sexual experiences during childhood, such as sexual abuse or rape, this leads to poor body image and also can cause premature ejaculation. In still other cases, there can be religious beliefs which cause guilt feelings during the sexual act, and therefore there becomes a tendency to rush through sexual encounters. In other cases, the person may be sexually inexperienced, the person may be in the novel phase of a relationship where overstimulation is all too common. There can also be an overall lack of estimation of their own sexual performance. Lack of confidence, depression or any other psychiatric illness, anxiety, especially about rejection by the partner, stress in other areas of life, relationship problems, and lastly, premature ejaculation can also be caused as a consequence of erectile dysfunction. Here, the man has an anxiety about being able to get and maintain an erection, and therefore they form a pattern of rushing through intercourse. On a biological level, we know that certain neurochemicals trigger ejaculation and other neurochemicals prolong ejaculation time. Testosterone, thyroid, and dopamine trigger ejaculation, whereas serotonin, oxytocin, prolactin, estrogen, and nitric oxide inhibit ejaculation and therefore increase or prolong the ejaculation time. This is necessary to know for all doctors before initiating treatment. Therefore, we get certain investigations done before we start the treatment of anyone with premature ejaculation. Out of all of these neurochemicals, serotonin is the most widely researched. We know for a fact that high levels of serotonin prolong ejaculation time, whereas low levels of serotonin trigger ejaculation and therefore may cause premature ejaculation. Other biological conditions include phimosis, where the penis is super sensitive to touch, diabetes, multiple sclerosis, which is a nerve disorder, excessive drug and alcohol use, nerve damage due to surgery or trauma, inflammation and infection of the prostate, and also it can be inherited, which means that it is transmitted from the father or the grandfather. I will now be talking about the medical and surgical treatment options for premature ejaculation. For home remedies, stay tuned for the next video. In terms of the medical management, be rest assured that there are lots of sexual health supplements, nutraceuticals, and medications to help you last longer. In the end, they all have the same working principle. They delay the signals that go from the sense organs to the brain, they delay the processing the brain does of these signals, and they also delay the signals that the brain relays to the penis to release semen. And this prolongs your ejaculation time. Remember that these are drugs that have to be prescribed by your doctor. Do not attempt to self-medicate because they do have some serious side effects if taken improperly. They may be prescribed to you either for daily use or just before sexual activity. Also, if you stop using them at some point, your premature ejaculation may return. Therefore, some patients require an ongoing treatment with these medications. If the medications don't work, the next option is surgery. Surgery works on the sensitivity of the penis, and therefore if the penis is less sensitive, less signals go to the brain and therefore the ejaculation time is increased. Now remember that although I'm educating you about these options, psychiatrists do not routinely perform these surgeries, and therefore you'd be best advised to discuss these options with your urologists. Let's take them one by one. The first option is frenuloplasty or frenectomy. Frenulum is the most sensitive part of the penis, and if it is tight, there can be more friction, because of which there is early discharge. In frenuloplasty, there is a slit that is done on the frenulum, because of which the frenulum becomes elongated. If this still doesn't work, the frenulum can be completely removed through a procedure called frenectomy. The second procedure is called glans enhancement. Here, a chemical called hyaluronic acid is injected directly into the glans of the penis, making it bigger. This creates a barrier between the sensations and the nerves that go to the brain. The third procedure is called dorsal neurectomy. Here, the nerves of the penis are crossed so that there is lesser signal that travels to the brain. The fourth procedure is called Botox. Yes, Botox. Botulinum toxin is injected into the pelvic floor muscles, and this paralyzes them for a period of 2 to 3 months. Therefore, it's temporary, and because of the paralysis of these muscles, the ejaculation time becomes longer. And lastly, circumcision, which is arguably the most effective procedure for the management of premature ejaculation, but it is highly controversial because of religious and ethical reasons. Even with all of these medical and surgical treatment options, remember that ejaculation is a learned reflex. You can train yourself to last longer. Of course, medications and surgery will help you last at least double the time that you're already lasting. But to increase time beyond that, you have to work on yourself. You have to train hard, you have to train long. And once you're able to do that, I assure you within a period of 6 to 8 months, you'll be able to last much longer. So this brings me to the end of the video. Thank you for watching to the end. I hope you enjoyed the video. I hope you were able to gain some serious knowledge about premature ejaculation. I hope that you will take action. Thank you again. Take care of yourselves.